Welcome to Beyond the Smile, the podcast where we dive deep into dental health, nutrition, and everything that makes life more beautiful.
Hey everyone, welcome back. Today we're going to be doing a deep dive into TMD.
TMD.
Temporomandibular joint disorder.
Yeah.
Jaw pain, clicking, all that fun stuff.
Yeah, if you're hearing this and you're like, oh, my jaw kind of hurts, this one's for you.
Exactly. And we're looking at some really interesting research from Prime Dental Group. They're all about TMD relief.
Yeah, and I think a lot of people don't realize how common this actually is.
Right, like 12% of people experience it at some point.
Yeah, and it's especially common for women, like between the ages of 35 and 44. It's wild.
So let's break it down. What exactly are we talking about when we say TMD? What does it feel like?
So, it can be a lot of things, but some of the most common things are like, well, obviously pain in your jaw.
Right.
That tenderness around the joint. And then maybe like clicking or popping sounds when you open and close your mouth.
Oh, yeah.
Sometimes it can even be hard to like move your jaw smoothly.
And headaches too, right?
Oh, absolutely. Headaches are a big one. And, it's not just like a little bit of discomfort. Like these things can really affect your everyday life. Like imagine trying to eat or talk or even just yawn when your jaw is all messed up.
Yeah, that's not fun.
Not fun at all.
So what can people do about it?
Well, one thing that the Prime Dental Group report really emphasizes is mouthguards.
Mouthguards. Like for sports?
Well, similar idea, but these are specifically designed for TMD. Sometimes they're called splints or night guards too.
Okay.
And they basically work in a few different ways. Like one of the biggest things they do is protect your teeth from grinding and clenching, which is actually super common, especially at night.
Bruxism.
Exactly, bruxism. And, that constant grinding and clenching can really put a lot of stress on your jaw muscles. So the mouth guard kind of acts like a buffer, it gives those muscles a chance to relax.
Okay, so it's not just about protecting your teeth. It's about giving those jaw muscles a break.
Right. And some mouth guards even help to reposition your jaw, kind of like how braces would straighten your teeth.
Interesting. So it can actually correct alignment issues.
Yeah, and that can make a huge difference in terms of reducing strain and preventing long-term damage to the joint.
So how do you know which mouth guard is right for you?
Well, there are a few different types. The report mentions over-the-counter options,
right,
which can be good for like a quick temporary fix.
Yeah.
Then there are boil and bite mouth guards that you can kind of mold to your teeth at home.
Oh, yeah, I've seen those.
And then there are custom-fitted mouth guards, which are made by a dentist specifically for your mouth.
So those are probably the most effective, right?
They definitely tend to be. They offer the best fit and comfort, and they're the most likely to actually address the underlying causes of your TMD.
But I'm guessing they're also the most expensive?
Yeah, that's the trade-off.
Well, I guess it's worth it if it gives you relief. It's an investment in your health.
Absolutely. And, the report also talks about this idea of holistic TMD management, which I think is really interesting.
Holistic?
Yeah, like looking at the whole picture.
So not just relying on a mouth guard.
Exactly. It's about incorporating lifestyle changes, therapies, stress management, all of that good stuff.
I like that. What kind of lifestyle changes are we talking about?
Well, for starters, think about what you're eating.
Okay.
Like, are you constantly chewing on hard candies or gum?
Guilty as charged.
Yeah, well, maybe try to cut back on those things.
Okay.
And focus on softer foods that are easier on your jaw.
Makes sense.
You can also try applying heat or cold packs to the area to help with pain and inflammation.
Yeah, that always helps with sore muscles.
Exactly. And then there are things like physical therapy and massage.
Oh, tell me more about that.
Yeah, so physical therapy can be really helpful for improving jaw mobility and strengthening those muscles.
I could see how that would be beneficial.
And massage can help to release tension in the muscles of your face, head, and neck, which can also impact your jaw.
So it's all connected.
It really is.
And you know what else I think is super important? Stress management.
Oh, yeah. Stress is a huge factor in TMD.
It's like when I'm stressed, I clench my jaw without even realizing it.
Totally.
So what are some good ways to manage that stress?
Well, things like meditation and deep breathing exercises can be really helpful.
Yeah, those are always good for relaxation.
And for some people, cognitive behavioral therapy, or CBT, can be incredibly effective in breaking those patterns of jaw clenching and grinding.
So it's a multifaceted approach, tackling the problem from different angles.
Exactly. And, in some cases, medication might be necessary to manage the pain and inflammation. Things like over-the-counter pain relievers or muscle relaxants can provide temporary relief.
Right, but always check with your doctor first.
Absolutely. It's important to consult with a healthcare professional before starting any new medications.
And what about for people who have more severe cases of TMD?
Well, there are some more advanced treatment options like injections or even surgery.
Oh, okay.
But those are usually considered last resorts.
So the injections, what are they injecting?
Things like corticosteroids to reduce inflammation or Botox to temporarily paralyze those overactive muscles.
Interesting. And surgery, that would only be for really specific situations, right?
Right. It's typically reserved for cases where conservative treatments haven't been successful and there's an actual structural problem with the jaw joint that needs to be corrected.
Okay, so it's really about finding the right approach for your individual needs and the severity of your TMD.
Absolutely. And remember, it's a journey, not a race. It's about exploring different options, finding what works best for you, and taking an active role in managing your TMD.
I like that. So are there things people can do at home to start managing their symptoms?
Yeah, definitely. The Prime Dental Group report actually has some great tips for that. Consistent mouthguard use is a big one, of course. And they also recommend some simple jaw exercises that you can do to improve mobility.
Oh, like what?
Well, things like gently opening and closing your mouth, moving your jaw side to side, and even just massaging the muscles around your jaw.
Okay, those sound easy enough.
Right. And we already talked about heat and cold therapy, which can be really helpful for pain and inflammation.
Yep.
And then there's the whole thing about avoiding hard, chewy foods, which we already touched on.
Right, right.
But another thing that people often don't think about is posture.
Posture, how does that affect your jaw?
Well, when your posture is poor, your head and neck are often out of alignment, which can put extra strain on your jaw muscles.
Oh, that makes sense.
So just being mindful of how you're holding your body throughout the day can actually help to reduce some of that tension.
So it's all about those little things we can do throughout the day to support our jaw health.
Exactly. It's about making those small, consistent efforts that add up over time.
Yeah, it's amazing how much of an impact those small habits can have.
It really is. And you know, what I think is so important is that we don't have to just suffer through this.
Right. There are things we can do to find relief.
Exactly. And you're not alone, you know? TMD is so common, and the more we understand it, the more we can take control of our own well-being.
I like that. So let's recap some of the key points we've covered. We talked about those custom-fitted mouth guards.
Ah, yes. Those are like a game changer for a lot of people, really getting to those root causes.
Yeah, and then that whole idea of holistic TMD management. Like, it's not just about the mouth guard.
Right. It's about making lifestyle changes, trying different therapies, managing stress.
Thinking about the whole picture.
Exactly. And, you know, if those things aren't enough, we did touch on those more advanced options like injections or even surgery.
Right, but those are for more severe cases.
Exactly. Most people can find relief with those more conservative approaches.
That's good to know.
And, you know, just to give credit where credit is due, this report we've been talking about is from Prime Dental Group.
Right.
They're the ones who really emphasize this whole holistic approach, which I think is so important.
Absolutely. And they're experts in this field, so it's good to have their insights.
Oh, for sure. And, you know, if any of our listeners are in the Bellevue or Lynnwood area, they can actually reach out to Prime Dental Group directly. Their contact info is in the report.
Oh, that's great. So if you're listening and you're thinking, hey, this sounds familiar, don't hesitate to reach out to a dental professional. They can help you figure out what's going on and get you on the right path.
Absolutely. Because, you know, we really do rely on our jaws for so much. Eating, talking, laughing.
All the good stuff.
And when your jaw is hurting, it can really affect your quality of life.
Big time.
So it's not just about alleviating pain, it's about being able to fully enjoy life. And that brings me to something I've been thinking about.
Okay.
We've talked a lot about how stress can impact your jaw, right?
Yeah.
But I'm curious, do you think it could work the other way around too?
You mean like, could jaw pain actually cause stress?
Exactly. Like if you're constantly dealing with pain and discomfort, it's got to take a toll mentally and emotionally.
Yeah, that makes sense. It's like a vicious cycle.
Totally. And it just highlights that mind-body connection again. You know, our physical health and our mental health are so intertwined.
So it's all the more reason to address those TMJ issues early on.
Absolutely. And, you know, it's fascinating how complex our bodies are. Like, you wouldn't think that your jaw could have such a big impact on your overall well-being.
But it really can.
Yeah, and that's what I love about these deep dives. It's not just about finding a quick fix. It's about gaining a deeper understanding of how everything is connected.
It's about that bigger picture.
Exactly. And, on that note, it's important to remember that everyone's experience with TMD is unique.
Right.
What works for one person might not work for another.
So it's important to find what works best for you.
Right. And that's where seeking professional guidance comes in. A dentist or another healthcare provider can help you navigate those different treatment options and figure out what's right for you. They can also rule out any other underlying conditions that might be contributing to your jaw pain.
That's a good point. Sometimes it might not even be TMD.
Exactly. So if you're experiencing any kind of jaw pain or discomfort, don't just brush it off.
Yeah. Get it checked out.
Early intervention is key.
It's like they say, an ounce of prevention is worth a pound of cure.
Absolutely. And what I find so inspiring is that even though TMD can be challenging, there's a real sense of hope that comes from understanding it better.
I agree. Knowledge is power.
It really is. The more we know about our bodies and how to care for them, the more empowered we become.
So it's not about being afraid of a diagnosis. It's about seeing it as an opportunity to learn and grow.
Love that.
And with the right information and support, we can absolutely find relief and live our lives to the fullest.
Couldn't have said it better myself.
And on that note, I think we've covered a lot of ground today.
We have.
Yeah, and it's so easy to forget that, you know, like you said, it's those little things we do every day that really add up.
It really is. And like we were talking about, I think that connection between jaw pain and stress is so interesting.
Yeah, it's wild how much they can affect each other.
It makes you think, like how much of the stress we carry around every day, like all those little tensions could be contributing to, jaw problems.
Yeah, it's like our jaws are holding on to all that stress literally.
Yeah, in a way. And that's why I think those stress management techniques are so important.
The ones we talked about earlier.
Exactly, like meditation, deep breathing, even just taking a few minutes to consciously relax your jaw muscles.
Yeah, throughout the day.
Right. It's like giving your jaw a little vacation.
I like that.
And when your jaw's relaxed, it can actually have a ripple effect on your whole body. Like it can reduce tension, improve your sleep, even boost your mood.
It's that mind-body connection again.
Exactly. And as we wrap up this deep dive, I think it's important to remember that this is just the beginning,
Beginning of what?
Of your journey toward better jaw health.
Oh, yeah, of course.
Like it's about staying curious, continuing to learn, and being proactive about your well-being.
Absolutely.
And there are so many resources out there, like online communities, support groups, qualified healthcare professionals who can guide you.
Yeah, and you don't have to do it alone, Like reach out, ask questions, connect with others who are going through the same thing.
Yeah, that sense of community can be so powerful.
It's like finding your tribe. People who get it, who can support you.
Exactly. And that's what I love about these deep dives.
Wow.
It's not just about the information. It's about connecting with each other and realizing that we're all in this together.
I love that. So to all our listeners out there who are dealing with TMD, remember you're not alone. There is hope for a more comfortable, pain-free life.
Keep learning, keep exploring, and most importantly, keep taking care of yourselves.
Couldn't have said it better myself. Thanks for joining us for this deep dive into TMD. We'll see you next time.